Now we are going to get started with inhibitors of cell wall synthesis, of which, can you remind me which cell wall synthesis inhibitor is not a lactam? It's vancomycin, right? So now what is a lactam? Now a lactam is actually a chemical structure that is most unusual. Look, it's the square that is referred to as a lactam. And any structure or any drug having a lactam is referred to as a lactam antibiotic. So if you look at cephalosporins also, you have this square over here. Right. Now it is this structure that is present or that is common for all the penicillins, the cephalosporins, but also it is normal for or similar for the other drugs in this group, which are imipenem, meropenem, and also aztreonam. Now, having a square in chemistry is most unusual for the simple reason that it is very unstable. So let me write it over here that this is highly unstable. Now, it is also very fragile. You see, making a square with carbon is making the bonds very tense and very likely to get ruptured, to get broken. Now, what the arrow over here is pointing is that it is actually indicating us that this is actually the weakest bond in the structure. And if it is the weakest bond in the structure, that bond between the nitrogen and the carbonyl right here is one of the weakest bonds. Now, well, that weakest bond is also going to be the site for resistance by the beta lactamases that are released by the bacteria. So it is the site of beta lactamases. These are enzymes that are produced by the bacteria, and these have one idea in their mind, and that is to cleave this ring. That is the idea that the lactamases, the enzymes produced by the bacteria, have. Right here, and totally when they do that, they will inactivate the antibiotic. That was actually the first mode of resistance elucidated by the bacteria towards these antibiotics. Now, as I'm looking at the beta lactamases cleaving that bond, you can imagine that chemists, by altering these R groups, have tried to protect the bond, also tried to change the solubility of these chemicals, and also potentially change the spectrum of these chemicals. Now, it is only fair to imagine that by far most antibiotics are actually produced naturally in fungal organisms, and these fungal organisms has evolved long before we humans have. These little chemicals to fight themselves the bacterial infections. So what we really do in pharmacology is very empirical. What we do is we actually isolate the chemical from the fungal organism and potentially do a few chemical modifications here and there, so that we have more pharmacokinetic than we have pharmacodynamic consequences. You know, what we are actually trying to change is we are trying to change the solubility so that we can give it either IV or give it either oral, or to try to make it cross the blood-brain barrier. These type of situations. Now that bond that is weak here will be the primary mode of resistance developed by these bacteria to these chemicals. So we will talk a lot about classifying those drugs based on whether they are beta lactamases sensitive or beta lactamases resistant. Now, another thing that I would like to recognize in this structure, do you see the sulfur over here? Right? So now what should we think about it clinically when we think sulfur? Now, of course, it enhances lipid solubility of the drug for distribution in the tissue, but it certainly allows some protein binding and the potential for allergies. Right. Now we know antibiotics are one of the classical group of drugs to have as a chief complaint from our patients, and that is hypersensitivity type of issues.